Sometimes kids are born and the head is like tilted to a side, and you feel like a little knot in the muscle, and the kids won't move their head away from that side. Shouldn't we be stretching that muscle a little bit to get it to move so it doesn't get more and more stiff?
Absolutely.
What would be a technique you would show a mother and a new baby after we're sure that's the reason? You know, be careful with other things. What would you suggest?
Well, once they see the pediatrician, and in fact I get a prescription that says the child has what they call torticollis, or I get a prescription that doesn't say torticollis but says stretching. Maybe the physician feels it's not torticollis, but it's safe to do so. Very often what happens is it involves the sternocleidomastoid muscle, which will bend the neck to one side but rotate it to the other side. So very often you'll have a child walking and they'll present with side bent left, but they're rotated or looking, as I explained to parents, right. It's very, very confusing to most parents when we explain.
So how would you tell them? What would you tell them to do?
What I would do is I'd go ahead and show the parent. Let's say the child needed to learn how to rotate or look to the left. I'd say, why don't you lie the child on their stomach, give them a pacifier, turn on a nice DVD or something, and put your hands on one on each side of their head and slowly rotate it so that their eyes are now looking that or looking to the child's left. I also warn the parents to stay above the mastoid bone, to stay over here, not to start yanking on the jaw, which is a more mobile joint and bone. Of course, never to touch.
Try to stretch the muscle in the opposite direction.
If you're side bent left and rotated right, you need to be side bent right and rotated left.
The complete opposite.
Yeah, because that muscle, the sternocleidomastoid muscle, as you know, has.
Some people talk about having the ear touch the shoulder. Is that a bad technique?
No, not at all. So basically, what they're saying to do is, if I'm side bent left and rotated right, and I want to work on the side bending component, I will say to mom, okay, we need to stretch the right ear so that it goes towards the right shoulder. And again, it's just so mom understands it in a simple term.
It shouldn't be forceful. It should be done consistently, smoothly, gently.
Yes, I always tell mom, let the baby win. This is not a fight. Baby's fragile.
And maybe sing to the kid while you do it. Make it like you're playing with the kid, and make it like an.
Absolutely.
And do it not once a day, but frequently.
Do it 3 to 5 times during the day. I say, help bring the head that way to look at whatever it is that you want to get them involved in. 30 seconds. Eventually, I'd like you to get them up to 5 minutes. It's going to get easier and easier. Let them watch it for 5 minutes. I have a kid who's...
So Toricollis, the technique, as we're talking, is do it slow, smooth. Don't create a lot of pain. Try to stretch the muscle. Do it more than once a day.
Absolutely.
And maybe you can just for a few seconds gradually increase the time. But the doctor should always check that is the reason. Yeah. There are other things that can do it. But usually physiotherapy is the best approach.
Absolutely. Absolutely. Again, if it's confirmed that it's torticollis, it's nothing to do with gastrointestinal, other types of reactions, and yes, that's what we would do. Another thing that we do in physical therapy is we'll approach it as a soft tissue problem, which it is, but also as a weakness, because very often the torticollis side is also a bit weak. So we'll go ahead and work with the child against gravity to go ahead and strengthen the child, because otherwise it can turn into a developmental issue a few months down the line.
If the kid's born with it, some of the best teachers that train me said always look at the hips, because sometimes the pressure here could be pressure below.
Yes.
Just a little tip. So we should check that very carefully and make sure the hips can be moved in directions, clicking or something like that.
Yeah, we always do ortolani sign and whatnot on each child that comes in for that type of diagnosis.
Even if a click doesn't mean it, but it's
right.
But good faith effort to make sure there is upstairs and downstairs something at the same time.
Right. Another thing we'll look for is any neurological responses. Hypothetically, sometimes a pediatrician can miss a simple ATNR. A kid comes in presenting...
Yeah, wait, what's it?
I'm sorry, asymmetric tonic neck reflex. It's also called the fencer's reflex. If you go ahead and turn a child's head towards the left at a young age, a newborn child will actually extend the arm of the side you're looking towards and bend the arm of the side you're looking the other side.
Neck. Oh, that's the theory where we came from monkeys. The monkeys reaching for the fakakta vine to go. We have different names for it, but that's okay. So in other words, that's proof that you, in particular, came from monkeys. Is that true?
That's my mother-in-law would agree. So.
Oh my God!
Yes.
I hit on that. But the point is,
yes,
you look for different reflexes. Make sure there's no neurological basis.
Right.
That's called good, sound evaluations. And sometimes you look at the head, There could be something in the neck, and sometimes you have to do a complete evaluation. But general, they're usually most of the time they're very benign. That's right.
Yeah, I tell the parents that torticollis is an easy treat. Not that anything is taken lightly, but I explain to them your child has something that can be rectified almost always rather simply by some decent therapy and some decent home exercise follow-up. If a parent goes home, I give them a printout of what to do at home, basically these 2 or 3 exercises. They do it readily, they come in, within a short while you see marked improvement.